A topic from microbiology called rabies. How rabies is being spread? We all know that it is spread through rabid animals. Rabid animals like infected dogs. Wolf is not common because it lives mostly in forests, right? And we can see mostly bat bite and from rodents also sometimes infected rodents. Okay, rabies is caused by rabies virus only. It is transmitted to human by rabid animals which are infected with rabies. Okay, it belongs to the family Rhabdoviridae. Oh, it is also okay. It belongs to the family Rhabdoviridae. It is caused by rabid animals. Okay, it's all fine. But what our point of interest here? What is the structure? Okay, wait. I will draw from the starting. What is the structure? What is the lab diagnosis? How it is occurring is our point of interest in microbiology. See, draw along with me. It will be easy. In this, there is negative sense single stranded RNA. First, this is negative sense single stranded RNA. I will tell for every word why it is like that. N and P proteins, these are nothing but RNA polymerase. I will tell meaning for every word, don't fear. This is nucleocapsid. Okay, and then it has matrix protein as covering. Then it have lipid bilayer. Okay, then it have lipid bilayer. It is in the shape of bullet. Okay, it is in the shape of bullet. And then it have G proteins spikes. What are these? G proteins. First, don't think this as box shape. It is actually this shape, bullet shaped, like this. One side curved and one side flat, bullet shaped. Okay. Here I told initially it has negative sense RNA. First, to know about negative sense RNA, first I will tell about positive sense RNA. In positive sense RNA, if it is entering our cell, it can directly make mRNA and it can lead to protein synthesis. But if it is negative, this is positive sense RNA. If it is negative sense RNA, if negative sense RNA is entering our cell, it cannot synthesize the mRNA. In order to synthesis this mRNA, along with this negative sense single stranded RNA, our rabies virus should also insert some of the proteins, that is nothing but this RNA polymerase. This one here, there is what cap like, right? That one also it should RNA polymerase, so that this normal process can occur. So that's why it is called negative sense RNA, as it cannot directly induce the formation of mRNA proteins, but it should insert one other protein from this virus only, inside from the virus only, that is RNA polymerase. So it is called negative sense RNA. Positive sense RNA can directly induce the formation of mRNA, but negative sense cannot do. Now we understood the structure. And what are the virulence factors? Virulence factors are this matrix protein mainly. Sorry, not matrix protein, this G protein and this nucleocapsid. Okay, this virulence factors, and the shape is bullet shaped. You have to write for sure short. This bullet shaped. Bullet shaped virus. Okay. Now what we understood? We understood what family it is, what is the structure of it, Okay, what is negative sense RNA meaning? Okay, it's fine. Now we'll see how it is entering our body and what it is causing. I have bitten by a rabid dog here. After bitten by a rabid dog, in my skeletal muscles, it take local replication. It undergo local replication in the skeletal muscles. Okay, it is replicated. Then it enters acetylcholine receptors more frequently, that is nicotinic receptors. After replicating in the skeletal muscles, it will enter one of the acetylcholine receptor, that is nicotinic receptor. Now you might ask why it is only entering nicotinic receptor, why it is not entering other. See, now if I am an MBBS student, how can I enter BTech college without ID card? That is the thing. Here, the specific proteins, the specific characteristic features of this rabies virus only allow here this nicotinic receptors to pass through. It, this nicotinic receptors only will allow this rabies to pass through. Okay, that's why it chooses this way. And one more, this is the survival strategy. See, if instead of entering to this acetylcholine receptors, if it enters the blood, what happens? Immediately the immunoglobulins and the cell mediated immunity will start, and it is been killed right firstly. So it is the one of the survival strategy also we can take. Okay. Somehow it entered into the acetylcholine nicotinic receptors. Then what happened? It goes through the sensory nerves. It axons, sensory nerve axons. It ascends upward. Retrograde ascending. It will ascend upward. Then what happened? Here, after sensory, it will cross spinal cord. Then it reaches brainstem. Then it reaches hippocampus. Then it reaches cerebellum. What happened after entering the nervous system through nicotinic receptor? It had gone through the axons of the sensory nerves, and then it gone to the spinal cord, then it gone to the brainstem, then it gone to the hippocampus, then it gone to the cerebellum. Okay, after going to cerebellum, what it do? Okay, till now it has traveling till now he had gone. Then what happened? Here, after this, from here it centrifugally transmit to cornea, saliva, and it might also go to some glands like adrenal glands. Its main niche is nervous system, not this glands. It goes to saliva to spread, but human to human saliva transmission is most of the case it is not seen. But the strategy of this rabies in going to saliva is that one only. Okay, in the cornea it can also go, in the adrenal glands also it can go. Okay, till here we understood properly. It had entered the everything had gone where it want to go. But when problems will occur to us, we have to see. First one, the stages. Prodromal stage. See, first what we talked, it is biting here, skeletal muscle replication, and going upward. So while passing through the sensory nerves, it will make the sensory nerves to irritate and produce tingling sensation. Okay, this is the first thing which is occurring in the prodromal stage, we can say. And as it is there, our immune system surely it will know that something is there, so our immunity will produce inflammatory mediators which lead to nausea, vomiting, and It will cause nausea, vomiting, and fever, and generalized malaise. Okay, it will cause muscle pain. Why? See, as it is traveling, it it will not allow the contraction and relaxation properly. So, which leads to body pains. Okay, what we understood till here, we got the prodromal stage. Then what happened? Then comes the furious rabies. The furious rabies stage. It is the acute neurological symptom stage. Okay, what happened? Till here it is okay, but when it entered this part, when it entered cerebellum, hippocampus, and brainstem, what happened? See, in our brain, there are many electrical impulses going on, right? Electrical impulses, our brain is mediated. What this rabies do is it disrupts everything. It causes excessive firing, sometimes no firing, sometimes again excessive firing, sometimes again no firing. It randomizes, every firing is disrupted. So what happened in this furious rabies? There is hyper excitability. Hyper excitability. Then he might have anxiety. Why? They are all, see, in the brain system, we are our brain is coordinating depression, anxiety. Every time we are not in depressed state. Why? Because our brain is doing something through these electrical impulses, so that we are not getting anxiety every time. But this rabies is doing whatever it want with the electrical impulses, right? So we get the anxiety also. We got hyperexcitability, anxiety, and hallucinations we get, and most of the CNS symptoms you can write here. And we can see cardiac arrhythmias. Okay, we can see cardiac arrhythmias, and then we can see lacrimation, excessive salivation. Okay, this is excessive salivation, this is lacrimation. Why there is excessive salivation and excessive lacrimation? See, what happened? Whenever we want to, see, we are taking some water in our mouth, and we want to take it into the stomach. How it happens? Our brain sends some signals to the laryngeal muscles to get that what deglutatory movement. It will movement like that, right? The spasm will be there. So due to this muscle contractions, it will be pushed down, right? ah that 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 contraction also disturbed by these irregular impulses. So what happened? Did you ever get a spasm in a hand or leg? How tightly it contracts? Like that only it will happen in the laryngeal muscles. Whenever we take water, what happened? Whenever we take water, that powerful spasm is created. So the person will land up in hydrophobia, that is fear of water. See, once a child came near me, I poked him with a needle. Once I poked, second time he came, second time also I poked, third time came, third time also I poked. Will he come near me fourth time? So he won't come. So in the same way, if the patient experiences the laryngeal spasm for 2-3 times, he will get fear of what? Deglutition. If it happens 2 or 3 times, he will himself get fear of deglutination, that is hydrophobia. Sorry, I am writing on the pen itself. He will get hydrophobia. I clearly explained why hydrophobia. and the same way he will also have aerophobia, that is fear of air. Same mechanism it will happen. So hydrophobia is there, aerophobia is there in the furious rabies. And one more thing, there is priapism. Priapism is erection for more than 4 hours without sexual arousal. That means without sexual arousal, the patient is having erection for more than 4 hours, and he will have ejaculations also improperly in this time. It is called priapism. It is also caused by the virus which is there in this brain. It is creating improper electric impulses to be gone to one neuron and other neuron, so it leads to the system's damage. Okay, we understood now what happens in the prodromal stage and the furious rabies. There is one more stage here, that is, see, I told now the patient will be having hyperexcitability, anxiety, hallucinations, right? He will in between. See, if here he is okay, this is first hour, second hour, third hour, fourth hour. If here is having the hallucination and all these feelings, in the second hour he will not have, in the third hour he will not have, and the fourth hour he will have. This the phase where he did not have the symptoms is called lucid interval. This is called lucid interval. That means he is not having these symptoms of furious rabies in this time. So as the disease progresses, the time of this lucid interval will decrease. That means if the disease is going on for many days, this lucid interval will decrease to, suppose here if it is 10 minutes, it will become 1 minute as it progresses. Okay, then there is something called paralytic rabies. What is paralytic rabies? Previously I told that the rabies virus is entering the sensory system through nicotinic receptors. But what if it enters the motor system? See, this is the body. It is entering from here. If it enters through the motor system, if it is entering through the motor nervous system instead of sensory, it will initially lead to the paralysis of this limb, and then it leads to the quadriparesis. Okay, quadriparesis. First, initially, as it is entering the motor nervous system, it leads to the paralysis of this limb, and then followed by 4 limbs will be getting paralyzed. So this is called paralytic rabies. Okay, in paralytic rabies, in where the rabies is entering the sensory nervous system, we are seeing hyperexcitability, anxiety, hallucinations, excessive salivation. We are seeing that this, right? So they might not be present here. Okay, because before it is entering the brain, it is initially causing all this, right? Okay, here only the patient might land up in coma and death, so they might or might not be seen. Okay, this is called paralytic rabies. Okay, one more important concept I will tell. There is a person who is 1 feet tall, and there is a person who is 2 feet tall. If the dog had bitten in the leg of both people at same places, okay, does this person show symptoms first or this person? This 1 feet person will show the symptoms first. Why? Because the distance between this leg and the brain is shorter in this person, and the distance between this leg and this brain is somewhat longer than him. somewhat longer than him. Okay, think if instead of biting here on the leg, it had bitten on the neck. That means the distance to travel for rabies is much more shorter. That means if instead of biting near the leg, if it bites near the neck, the symptoms might appear faster. Okay, the person will fasterly die. Okay, it also depend how uh, the time of incubation period will depend on the site of biting by the dog. Okay, this is finished, and the incubation period might be from 20 days to 90 days, that is 1 month to 3 months. Why this 1 month to 3 months? That is only the thing I explained now. Okay, I had told about incubation period also. What happened? We had got prodromal stage, furious rabies stage, and I had told about the paralytic rabies, and follow up what will happen: coma and death. Third stage will lead to coma. It will lead to coma and death. Okay. Okay, everything is finished about the mechanism, how it happens. Now we are going to discuss about the lab diagnosis, and I will make it very simple. See, there is antigen detection test, that is direct fluorescent assay. What happens in this is, see, there is a fluorescent dye, and anti-rabies antibodies are coated like this on the dye, and I will take specimen. What are the specimen? Tissue sample from nape of neck. What is nape of neck? This place is called nape of neck. Here we can take this one, we can take saliva. Okay, after taking this, I am making a slide. In the slide, I am keeping this fluorescent dye which is coated with anti-rabies antibodies and keeping here. This, after that, I am washing. This is very important step, and then I will observe if the rabies antigen is present. It will give apple green birefringence. See, why this washing is important? Because if I am keeping fluorescent dye, everything will shine, right? So that's why I am tagging it with antibodies. Why I am tagging? If antigen is present here, it will bind with that antigen, and here only the fluorescent specific particles will be. If antigens where all the antigens are present, there only it will be there. And if I wash, the remaining area will be washed out. That means there is no antigen there. But if I don't wash, the total area will be shining. We can't see. So the washing is very, very important. This is the DFA, direct fluorescent assay, and it is the gold standard. It is the gold standard method of detecting rabies antigen. Okay, very easy, right? And then we can do RT-PCR in nucleoprotein detection. In nucleoprotein detection, we can do RT-PCR. Okay, it's also good. In detection of antibodies, we can see. I will tell a concept here. In the CSF, if I am affected, okay, in the CSF and in the serum. In the serum, the formation of antibodies take much longer time. The appearance of antibodies will take much more time, and they will appear in the serum. And see here, in the serum, these antibodies might be appearing if vaccinated, or also if the dog bite him. That means, for example, the dog is biting him, so he can have antibodies. Okay, the dog had not bitten him, but he is taking vaccination. Also, he is having antibodies. So, okay, if I do now antibodies test, whether I'll how can I know that it is due to vaccination or it is due to dog bite? So, serum is not reliable, but CSF, in the CSF on antibodies will appear only if the dog bites, not due to vaccination. So we can CSF sample is reliable in antibody detection, and the methods are mouse neutralization test, rapid fluorescent focus inhibition test, fluorescent antigen viral neutralization test, and then indirect fluorescent assay. This all are test names. We can't change the test name, right? So you can remember this indirect fluorescent assay and mouse neutralization test. You can remember. Okay, this RFFIT and FAVNT. You can try if you can. That is rapid fluorescent focus inhibition test and fluorescent antigen viral neutralization test. Okay, if you can remember, this both are easy. These are in the antibody detection section. And there is one more, that is animal inoculation, in which we inoculate the patient serum sample into mouse, for example mouse, and we'll check the brain biopsy, and if we see negri bodies, it might be positive test, and this will also be concluded by immunofluorescence only. Okay, now we are seeing a new term, negri bodies. What are these negri bodies? See here, what I told in the first class, first section, I told that it is going into the brain, and there also it replicate. While this bullet shaped bacteria is replicating, there to this negative sense single strand RNA there is nucleocapsid, right? This nucleocapsid will be deposited. This nucleocapsid will be deposited. Where it will be deposited? It will be deposited in, and see, remember like this, where it is deposited. Kinje bellum. Purkinje fibers of cerebellum. Why I am telling Purkinje fibers of cerebellum? Means with the code, because there is an MCQ on this. And one more, hippocampus pyramidal cells. In the MCQ, he might give hippocampus Purkinje cells and cerebellum pyramidal cells. Means he might crisscross this one. So you have to be cautious whether the connection is correct or not. So I told the code Kinje bellum, you can tell Purkinje fibers in the cerebellum. Okay, this code might be somewhat weird, but okay, I thought it would be better. Okay, what actually are these negri bodies are? These are nucleocapsid which are accumulated during the replication of the rabies virus, and these are eosinophilic. These are present inside the cells. So intracytoplasmic inclusion bodies which are stained. What is the stain we are using here? H&E stain we can use. Oh, sorry, I am out of ink. I am changing the pen. Eosinophilic intracytoplasmic inclusion bodies which are stained eosinophilic through eosin, and in the center it have basophilic granules. Okay, what is the mechanism of formation of this negri bodies? I had told. Okay, this one also good. We had diagnosed the negri bodies also. Okay, till now here is finished. Then what else in the lab diagnosis. Okay, that's thing. Okay, what happens if the dog bites us? What we have to do? That is in the treatment part. We have to see. Okay. In the treatment, there is a WHO classification, that is category 1, category 2, category 3. In the category 1, see, these categories are divided on the base, on the extent of exposure from the rabid animal. Okay. See, in the category from 1, we are just touching the animal, touching or feeding. Okay, here we no need to take vaccine. But in the category 2, it is scratching us. Some scratching is there, but no bleeding, no active bleeding, but just scratching. We can take, we should not can, we should take vaccine here. Okay. In the category 3, there is a strong bite, blood is also coming out, so we should take vaccine and also rabies immunoglobulins. Okay. If there is, means if rabies immunoglobulins are given according the patient condition and the fastness he had come to the hospital. Okay. Now we'll discuss about this vaccination and rabies immunoglobulins. See, rabies immunoglobulins can be created, means can be prepared from human serum. Those are human rabies immunoglobulins, or it can be created from equines. That is, equine means horse. That is equine rabies immunoglobulins. It is made up of it is made from horses, so its name equine rabies immunoglobulins. This rabies immunoglobulins we can give if the bite had occurred in the less than 7 days. In the gap of 0 to 7 days only we have to give. After 7 days, it's of no use. Okay, rabies vaccination. The site of vaccination of rabies is also important. It can be given intramuscularly or intradermally. And remember this point, it should be never given in gluteal region. Why it should not be never given in gluteal region? Because in the gluteal region there is so much fat. This fat, what it does, it delays the absorption, it decreases the rate or extent of absorption of the drug, so we should not give in the gluteal region. We can give intramuscular or intradermal, and intradermal is more effective. Why also I will tell. See, in the intradermal region there are active ACPs. That means this active ACPs, and there is active immune system working under this dermis. Okay, so in the dermal region, if you give, there is an immediate immune response. Immediately this APC will take antigen presenting cells will take, and immediately there will be antibody production. So that is the thing. Intradermal is more more potent. Okay, in intramuscular this is also okay, but not better than this. Okay, what is the schedule now? In the schedule, if you are giving, okay, I did not tell the site, right? If it is in the children, you should give in anterolateral region of thigh. If it is in adult, you can give in deltoid region. Okay, anterolateral region of the thigh you can give in children. See, in the IM, if you are giving in only single site, you have to give in third first the day on which the dog had bitten, and the third day and the seventh day, and between 14 to 28 days. In the first day, sorry, in the first day, that is the first day of dog biting, you have to give. On the third day you have to give, seventh day you have to give, 14 to 28 days you have to give. If it is only single site vaccination, that means you are injecting only in the delta region. If you are choosing two site regions, means if you are injecting in two sites, you can give two doses, the 0th dose and the first dose, on the day of his first visit only. On the day of biting, if he comes, you can give two doses simultaneously. First you can give, then the second and third doses will be on 7th and 21st day. See why this regimen is prepared instead of this, because see, here the patient should come on the 0th day, on the first day, on the third day, 7th day, 14 to 28 days. This means 4-day visits are there. But here on the first day you will come, and then on the 7th and 21st, the number of visits to the hospital will decrease in, right? So this is prepared. And in the intradermal, you can give on 0, 3, 7. If you take this 3, it's finished. And this is the post exposure prophylaxis, and there are some more things, that is clean the wound properly, wound hygiene, clean the wound properly and take to the hospital immediately, it will be there. And there is one more thing, that is pre-exposure prophylaxis. This pre-exposure prophylaxis, who can be taken? This pre-exposure prophylaxis, veterinarians, dog handlers or any animal handlers who are at major risk, and lab workers. To the lab workers, rabies might also spread from aerosols, sorry, not droplets. In the aerosols also it might spread in the lab workers. So lab workers also should take this rabies vaccination, and veterinarians, animal handlers also should take. And this is almost all the